Good morning. My name is Jay Rothman, and welcome to Real People, Real Health. It is actually Friday morning here in the U.S. It's an early 8 a.m. on the West Coast. Coming up, well, if you're back in the U.K., it's about 8 hours later. Welcome to the show. I am excited to have this morning Dr. Khan in the studio. Welcome to the studio, Dr. Khan.
Thank you for having me, Jay. It's a pleasure to be here.
You know, you make it easy being that you are, in fact, you're based in Arizona. We are on the same time zone, so it made it a lot easier for us to schedule this show. For those of us that are joining us in a show in the community, whether on live or replay, I'd like to just take a few minutes here just to share a little bit about Dr. Khan's background. Dr. Khan supports and manages patients with chronic conditions using a comprehensive approach by merging the exciting advances of functional neurology and functional medicine. Dr. Khan is board certified in integrative medicine, functional medicine, and a board certified chiropractic neurologist. He is the creator of the NeuroMetabolic Integration, a virtual functional medicine program that identifies the root cause of autoimmune and other chronic conditions. Dr. Khan has over 5,000 patients from across the country that have come to seek out his holistic approach that is changing the lives of those suffering from chronic conditions. A little bit more of your background, Dr. Khan. You were born in Taiwan and immigrated to America at the age of 13. You have a deep appreciation of the Eastern wisdom and Western advances in natural health care. You believe in the God-given ability of the body to heal and regulate itself. Just a little bit of your technical background. You are a diplomat, American Chiropractic Neurology Board. You are a fellow American Associate of Integrative Medicine, certified functional medicine practitioner, and you are a certified gluten practitioner. Now that one caught my attention when I was reviewing your accreditations, because I wasn't even aware that there was such a thing as a certified gluten practitioner. We will get into that. But for the moment, again, I'd like to welcome you to the studio and thank you for being willing to come in and have this conversation.
No, it's like I said, it's my pleasure. It's always good to speak to people and share what I know, and hopefully it helps someone.
Let's take some time here to chat a little bit about. We don't need to go back to when you immigrated here at age 13 to the U.S. But what I am interested in is, as part of your practice, you do share a little bit of your backstory and what some of your motivations were to, let's say, up your game and continue your education so that you can actually help a couple of family members that were impacted by different chronic disorders or diseases.
Yeah, my father, when he was 75, was diagnosed with stage 4 liver cancer. And at the time, age 75, they say basically he has 4 months to live, go take care of the affairs, and that was it. So I was in chiropractic school at the time. I haven't finished yet, and my brother's also a physician. So we refused to take that diagnosis. And so we started to do our own research, started implementing some dietary changes, supplements, and lo and behold, 4 months to live turned into 5 years. And that's 5 years, high quality of life. My father lived really well. He has no symptoms. And so that taught me something. That taught me that it doesn't matter how severe and how chronic, what they tell you, how bad it is, that there's hope, that there's always something you could do as long as you address the root cause. And the body's really powerful. It can heal itself. And then, fast forward, my second child, my son, when he was just a toddler, 2 years old, 1.5, he was up in grandpa's cabin, and he had a scalding injury where hot boiling water spilled down the side of his body. And he had a 3rd-degree burn over 15% of his body. And, long story short, I had to, basically take him to the burn center. We had to do all that stuff. And what happens is he developed severe neurological symptoms like night terrors, temper tantrums. He also developed severe upper respiratory symptoms like, chronic asthma. He had allergies and sensitivity to like foods and pet danders that he never had before. And later on, I learned that trauma, that inflammatory response triggered leaky gut and trigger inflammation in the brain and other area that cause these sensitivity, allergies, and behavior problems. But at the time I didn't know, and I thought he was, going to become autistic. And so that led me down into learning about neurology. I got my board certification in functional neurology to really learn how to help my child. And so that's kind of where my practice started taking a turn to something different than just regular musculoskeletal care. And then my third child, my daughter, when she was just a toddler, she got into older brother's leftover lunch, cheese quesadilla, and had dairy in it. And at the time we didn't know, but she took a bite of it and she developed anaphylactic reaction to dairy. And she was swollen everywhere, face, her groin was swollen, and we had to rush her to the hospital. And I just remember sitting in the back of the ambulance on the ride to the hospital with my daughter, that I thought that, I'm never going to let this happen again. I'm going to figure things out. So that led me down into functional medicine, learning about food sensitivity. And, along the way, I had great mentors like Dr. Tatis Karazian, Dr. Ari Vashdani, a lot of doctors who have taught me a lot. So I'm not that smart. I don't do original research. I just know who the smartest guy is and I go learn from them. And I'm able to put it together and communicate it to patients and my audience in a way that they understand it, right? So it doesn't help if I spit out Latin or medical jargon. So I try to speak in English, and I think this resonates with a lot of people. People really enjoy the YouTube channel content, my Facebook content. I put out a lot of videos, educational videos, just to help people understand what functional medicine really is and how it's meant to be done and what healing really means. So that's kind of my journey. And, I always feel like God has a purpose, through illness in the family. It's kind of got me to this place where I'm able to help a lot of people.
That's amazing that you were touched even in your own family with the challenge of symptoms, and from your upbringing, your background, your education, you were not satisfied to just treat symptoms. You actually had the desire, an urgent desire, to look at perhaps what could be the root cause behind a symptom that your loved one had. And that led you to further education and being that you're a highly educated man in your field, you weren't overwhelmed with what that would look like. Because, for the average layman like myself, who when a symptom pops up, the first thing I do is I don't go to see a doctor. I go to the internet and I start doing research. And depending on who wrote the article or who's subsidized the research study, I find a tremendous amount of conflicting information. And then that brings me to that emotional state of feeling overwhelmed. Like, who do I believe? What's right? What's wrong? So I guess, for me, my question to you is what would you suggest for the average person who does not have the resources that perhaps you have available, that is trying to understand why their loved one or they themselves are all of a sudden in an acute state of pain that leads to chronic pain? Where's the best place to start for resources, for information to figure out what's going on and not just go run to the doctor for a pharmaceutical drug to treat a symptom?
Yeah, and that's a great question, Jay. And my content really caters to people who are seekers and searching for answer. And I think some of that comes from my own tendencies. I'm just curious. I like to know how things work, and I have to satisfy my own clinical curiosity. When a patient comes in with certain presentation and they didn't respond to certain treatment, either by me or by somebody else, there must be a reason for it. So I just continue to search. And so, after 5,000 people, you start to see some patterns, right? And then you're able to, kind of come up with, an algorithm for how things work. And then luckily enough, I'm able to kind of put that in various YouTube videos. So, for people out there who are looking for answer, I would say, you kind of have to be careful the information you get, because a lot of information is kind of generic. I see out there, oh, if you have pain, you may have inflammation. Here's a herb for it, turmeric. Well, heck, there's some people that take turmeric and they don't feel any better. I mean, is it because they have pain, and where's the pain, right? So you have to ask better questions to yield better answers. pain. Okay, well, what if you just have sciatica because you have a nerve pinch? Well, in that case, you need to go see a chiropractor or a physical therapist. What if your pain is different, or you get adjusted, you do all this physical stuff, it doesn't get better? Well, maybe there's an inflammatory component to it. So maybe you work on a diet at the same time. So I think you got to get better. You got to ask yourself better questions and then use the internet as a resource to help you answer those questions. The internet's not going to ask the question for you. You have to ask the better question. And that sometimes can be difficult for a layperson who doesn't have clinical training to even know what to ask. So I think gathering information is good, and self-help is great, but I'm very pragmatic that way. The litmus test for me is, are you better, right? If you do whatever on your own, exercise, eat better, yoga, that's all awesome. Are you better? And if you're not, then consider the possibility that it may not be that you don't have enough yoga. It may not be because of a meditation deficiency. It may not be because you're eating badly, because you already, and what do you do then, right? So this is when you have to ask other questions. Is it potentially an autoimmune issue, toxicity, underlying infection that you cannot diagnose yourself, right? Just the other day, I had someone that come to me who actually works for another influencer. Now the influencer, does a lot of stuff online, and but the influencer is not a medical doctor. They just put out a lot of health information. And this person is actually on staff with that particular person. And the influencer actually referred this person to me because this person had a health problem. And the influencer is not claiming to diagnose or treat anything. And so he has, good border, boundaries. So referred to me. And what I found is that this person had severe iron deficiency anemia and also Epstein-Barr virus that, basically nobody ever asked, and she didn't know to ask, and the doctor didn't check. And these are not very difficult problems. I mean, iron deficiency anemia, of course you give them iron, but you also have to find out why they're iron deficient in the first place. Could be due to absorption problem, leaky gut, whatever it might be. So the point is, sometimes you can fix it yourself. If you do certain things yourself and you get better, awesome, then you're well on your way. If you're not better, that's when it's time to ask better questions or perhaps get professional help, right? Because diagnostic tests can be very helpful. And that person wouldn't know that she's anemic. She just feels tired,
Right.
brain's not functioning. And sometimes the test is helpful.
What I love about this show today, Dr. Khan, is that the majority of the time I go live, I have guests come in that have a backstory of their own health and healing journey. And on occasion, I'm honored and humbled to have a guest such as yourself who actually is coming from the other side, where you're actually providing insight, hope, and inspiration for those that are perhaps deep into a chronic condition, that there are solutions out here, not just to treat the symptom and not just to mask it with pharmaceuticals, but your intention is to always go after the root cause. Now, we're going to get into that in a moment here, but what I'd like to do is invite you to kind of help clarify a couple of words that have been mentioned today, because it's only been in the last maybe 5 or 10 years or less that, for me, it's way less, that the word functional and integrative medicine entered my life. For those that may not be familiar with what is functional medicine, what is integrative medicine, are they the same, are they different, and how do they differ from going to see your primary care physician in the local community?
Sure. Yeah, that's a great question, because functional medicine being thrown around like a jargon, and a lot of people are enamored with it. I will say a lot of healthcare practitioners enamored with it, and I will say even a lot of people say they're doing functional medicine, but it's really not, at a highest level that actually create the best result. So functional medicine is really not a pill. It's not a software or an app or tool. It's really a way of thinking. It's a philosophical construct, medically speaking, to try to identify the underlying physiological causes of why someone has a problem. And then you would address that whatever that root cause is, and you can do it with a drug. Functional medicine doesn't mean you can't use medication. And I'm certainly not anti-medication, because there's a time and place for everything. Okay, so So functional medicine basically is a way to look at a patient by gathering data, asking really good questions, right? I'm really a big fan of asking good questions to get better answers, because you don't know what you don't know. So if you don't ask the right question, you're not going to get to the right answer. So it's asking really deep and good questions, paying attention to patterns, and then using diagnostic tests, functional medicine tests, to look at nutrient deficiencies and toxicity to confirm your suspicions, and then using whatever means necessary, lifestyle change, nutrition, detoxification, or medication sometimes, to bring that person back into balance, to help that person. That's functional medicine. It's a way of thinking, a way of practicing. Integrative medicine simply means that you're integrating multiple disciplines. So integrative medicine physician might integrate meditation as part of the way of helping the patient, might integrate yoga and exercise, might integrate massage and Tai Chi, might integrate nutrition, might still use medication. So integrative medicine just means you're integrating multiple disciplines of medicine to help someone, where functional medicine is a way of thinking how to solve a case, how to be a detective. So that's the difference. Now, how is that different from what your primary care doctor does? Well, what a primary care doctor does is allopathic medicine, and that's neither integrative nor functional. It's very a one-sided, one-dimensional approach using drugs and surgery, right? So when you go to medical doctor, it's basically what you're going to get is a drug or surgery. That's pretty much it. That's from your primary care. Unless your primary care is doing integrative or practicing functional medicine, a typical primary care is going to be leading to the treatment of either drug or surgery for the purpose of treating a symptom or disease. And that's about it. Whether you feel better from that treatment or not is almost irrelevant, even though they claim to treat symptoms, but it's almost like, the treatment kind of maintains the disease. So you're kind of on this ongoing train where you have to constantly take something. And even when they say preventive medicine, there's nothing preventive about allopathic medicine, because what they do is early detection. And early detection does not prevent anything other than early detection, meaning you just found a disease in early state, right? For example, cancer. Early detection of cancer means you already had cancer, you just found it earlier, but you already have cancer. There's nothing preventive about it. So that's really important to know, because it doesn't mean allopathic medicine is not important or doesn't serve a place. There's many times in my life, in my family's life, where we had to go to allopathic medicine for treatment of a medical emergency and so forth. And that's really important. However, for most people with chronic health conditions, it's just simply insufficient. And the reason is not just because it's allopathic medicine or it's drugs and surgery. It's really the confluence of that, as well as how the system is set up and how the insurance and third-party payer, and that all get messed together where there's a lot of conflict of interest. And what happens, people are just not getting the right care. So I step outside of the box a long time ago. I don't work, with insurance, because insurance is going to dictate to the doctor what they can or cannot do. And mostly it's going to dictate to them, treat symptoms with their drugs or surgery. That's really what insurance pays for. So I stepped outside that box a long time ago, but I think the public doesn't know that, right? So it's great that we're having this conversation, because the public think that insurance is going to cover everything and the doctor knows everything. Well, the doctor, the primary care in a typical setting, knows what they know, which is, what's your symptom? What drug can I give you for that symptom? Which is totally fine. But remember, it's all about the result, right? It's the limit test is, are you better? If you take a drug and you're better and you don't have any problem anymore, you don't have to continue to take that drug, that's great. Maybe it's just a one-time deal. But if it's not, then you need to ask, again, better questions, dig deeper, and perhaps work with somebody that can help you get that deeper answer.
Love that answer. Thank you for clarifying that for me and for those that are in our community. What I would like to do is just acknowledge some of you that are coming in from the East Coast watching us live. Lisa Fox, it's awesome to see you. Thank you so much. Robert C. Stern coming in from Long Island, New York. Well, maybe from New Jersey now, I think, perhaps. But we did grow up, went to school together. Kathy Waldowski, good to see you. Sharon Allen. Let's see, Elizabeth coming in from the East Coast, the Northeast of the United States. Thank you so much. I've actually got my mom coming in from Boynton Beach, Florida. Mom, good to see you this morning. My beautiful angel, Mary Kelly, who's actually on her way. She is about to step into a yoga class in our community. She's watching us live as she's preparing to get into her Zen mode. You know, Doc, I absolutely love your explanation and clarifying that because, like you said, sometimes we get caught up in a fad or a trend in society, and we start to abuse and misuse words. Like, for example, holistic. That's another buzzword that today is misused. You go to restaurants and everything's artisanal. Even I mean, it's just words that are just that we just grab onto these one-liners, these one words, and we stamp it as reality, as the truth, and it isn't always so. And so I really appreciate you clarifying, distinctly explaining the difference between traditional Western care and functional and integrative. I was one of those people that was had no idea. I was asleep, relying on pharmaceuticals and surgeries to treat acute and chronic disease. And you know, the biggest challenge is that why we do what we do today is so that we can bring awareness and help guide people to their own awakening, that they do have choices today, that we don't have to accept the diagnosis. We can accept the diagnosis, but we shouldn't accept the prognosis and a life sentence that a doctor, your doctor, may in fact stamp you with, tattoo you with, and then that tattoo becomes part of it becomes you, it becomes part of your identity for perhaps the rest of your life. One of the areas you mentioned that you treat chronic conditions, but one of the areas that is of great interest to me, and I believe the majority of community guests that are watching and live with us right now, is in fact autoimmune. And you know, my understanding is that the majority of autoimmune, if not all, diagnoses, Western medicine says there are no cures for. They treat the symptoms, and the majority of people that stay within the treatment plan accept that that is their truth. What is your truth about autoimmune?
Well, the truth about autoimmune is that there's a lot of people being affected by it. About 50 million Americans are either diagnosed or most likely have autoimmune disease. And just so you know, 50 million people with autoimmune disease, to put it into perspective, heart disease, it's about 22 million people that have heart disease. Cancer is about 9 million. So if you add 22 and 9, the people that have heart disease and cancer, it doesn't even add up to the number of people that have autoimmune disease. So this is a very there's not enough awareness out there about autoimmune disease. And the reason for that is twofold. Number one, on average, it takes about 10 years for someone with autoimmune disease to get diagnosed. From the onset of symptom, first noticing something's wrong, to the time they actually get a diagnosis. And the reasons for that, because autoimmune disease, the nature of that is it waxes and wanes. It comes and goes. So you may have a period of exacerbations followed by a period of remission. So it can be very difficult to catch. And many times the autoimmune disease, the symptoms are very diverse and subtle. So it can be like multiple areas. And that's the nature of autoimmune as well, because you can have multiple autoimmune disease. Your immune system can attack multiple parts of the body. Nobody ever says that you can only have celiac disease and that's it. I mean, you can have celiac and Hashimoto's and rheumatoid arthritis all at the same time. So what happens is people have multiple symptoms and then you get passed from doctor to doctor with no answers. So that gets really frustrating. The number two reason why there's such an under awareness for that is because the current medical paradigm for treating autoimmune disease is basically treating the wrong part of the body. So let me give you an example. Like for cancer, right? Under the umbrella of cancer, you have different types of cancer: skin cancer, breast cancer, brain cancer, many types of cancer. Now, when you have cancer, typically the doctor you go to is, who's the doctor that treats the cancer part of it? The oncologist, right? Mm-hmm. The oncologist zap the cancer with chemoradiation. Whether that's the best approach or not, that's a different discussion. But let's just say for the purpose of this discussion here, if you have skin cancer, you don't necessarily see the skin doctor, you see the oncologist for the chemoradiation if it has metastasized. If you have breast cancer, you don't see the breast doctor, you see the oncologist. If you have brain cancer, you don't see the brain doctor, you see the oncologist. And rightly so, because it's a cancer that's grown in different parts of the body. So the problem is not the body part, it's the cancer, right? Now, for autoimmune disease, under the umbrella of autoimmune disease, you have many different types of autoimmune. You have Hashimoto's, which is immune system attacking thyroid. This is the most common autoimmune disease. You have celiac disease, which is due to gluten intolerance causing villus atrophy. So it's autoimmune attacking small intestine. You have things like rheumatoid arthritis attacking the joint. You have MS, which attacks the brain. And you have, in fact, 80 to 100 different autoimmune diseases out there that we know of, and many more that's still to be identified. So you can have autoimmune disease against any tissue. Now, when you have Hashimoto's, autoimmune attacking thyroid, guess what kind of doctor you go to?
Thyroid doctor.
Endocrinologist, right. And when you have celiac disease attacking the gut, what kind of doctor you go to? The GI guy, right? Gastrointestinal specialist. If you have rheumatoid arthritis, you go to the rheumatologist. And if you have MS, you go to the neurologist. So you see, with autoimmune disease, you go to the doctor that treats the organ, but under the umbrella, it's really autoimmune. It's the immune system attacking the parts of the body. Like cancer, it's not a breast problem or skin problem or a brain problem. It's cancer happening in those body parts. With autoimmune disease, it's immune system attacking those body parts. So it's not a thyroid problem. So when somebody has Hashimoto's, first thing I tell them, you have Hashimoto's. You don't have a thyroid problem. You have an immune system problem. When people have celiac disease, first thing I tell them, you don't have a GI problem. You have an immune system problem. Because attributing it to the right thing will help you seek the right treatment. Because if you treat Hashimoto's purely as a thyroid hormone problem and you get thyroid hormone medicine, then you're missing the whole other half of the equation, which is the auto.
What you're saying, I'll simplify it. We're treating the symptom. We're treating the vital organ that's being compromised by an autoimmune reaction, a switch on. And so we're treating the symptom rather than going after the root, right?
That's another way to put yes. At the base of it, you're treating the symptom, not the root. But it's important to make that distinction because people often don't think of autoimmune disease as an immune system problem because they think, oh, I have Hashimoto, I have a thyroid problem. So I want to make that distinction that it's an immune. So treat the symptom, treat the root cause, not the symptom. But what's the root here? The root is autoimmune. Now, I would say even beyond that, that's not even the root. Because when you have autoimmune disease, there are triggers for it. Like, then you have to ask, why do you have autoimmune disease, right? And then why do you have that? And why do you have that? When you can't get to any more whys, 7 layers deep, that's your root cause. A lot of times people just say, oh, I have autoimmune because I have gluten sensitivity. Okay, why do you have gluten sensitivity? You know, some people say, well, I have autoimmune disease because I have candida overgrowth. Okay, why do you have candida overgrowth? And then why that? And then why that? If you keep asking better questions and deeper questions, you get a different answer than just, oh, I have a thyroid problem. Because there may be 7 layers deep or more of why you have thyroid problems.
I love that. I was actually in a conversation with one of my clients just a few days ago, and we were on a call, and he sounded really congested, really bad. And I asked the next day we spoke, and I said, by the way, are you fighting a cold or an infection? And he says to me, I have really bad allergies. And he said, and yesterday was really, really bad. It really took me out. And so we just started talking very briefly. We just touched on health just enough. And I said, well, tell me about your nutrition. And he says, oh, I eat good because I eat a healthy diet, healthy lifestyle. And he looks great. He's a fit guy and he takes care of himself. I mean, at least it appears on the outside that, well, the further we got into the conversation, he says to me how much he loves dairy. He eats a ton of dairy. Now, I'm not a doctor, and so I wasn't gonna, give him a direction on what he should and shouldn't do. But my point being is that even when we have a belief that we are eating healthy, we all have a different, let's say, understanding of what healthy nutrition is. Based on, a lot of the time, it's our belief system. It's what we're taught. But we're misspoken or mistaken, I should say, when we think we're eating healthy, when in fact we still may be, there may be things that we could do or change in our nutrition that would in fact help our symptoms, such as allergies. Right? So he's been on Zantac forever. And he says, I'm so sick of taking that. I don't like how I feel on it, but I basically don't know what else to do because no one's giving me direction. No doctors give me any answers.
And the answer's out there, right? And I will say also on top of that fact, Jay, that, when somebody says they eat healthy, I agree. What does that mean? And I would also say that healthy for different people is different things, right? Some people can have dairy and they're just fine, no allergies and no symptoms, they're just doing great. Another person, they can't have cabbage or pineapple, like a weird one. So, one man's food may be another man's poison. So what can constitute a healthy diet? There's some general rules, right? You can't be drinking Coca-Cola all day and eating sugar and Skittles all day and expect that to be healthy, whether you have symptom or not. However, I would say that this can be highly customized to each individual, depending on individual sensitivity, especially when you're dealing with people with autoimmune disease. There tend to be a higher rates of multiple food sensitivities, and these sensitivities can be different from people to people. So not everybody has the same set of sensitivities to food. Just because you have autoimmune doesn't mean it's always the same thing, although there are commonalities. So this is where, again, working with someone or paying really close attention, journaling or testing, there are ways to find out. But I don't agree. I no longer, I used to think that, there's one diet, paleo for everyone. Well, now I don't think that anymore, right? Because some people may be eating paleo, but still feel terrible because something in paleo, one of the food they have sensitivity to. Or it could be that it's not even the food. So this will be like someone who comes to me like, I already eat perfect. And I ask, and wow, they are eating pretty darn good. They're not eating anything that I would deem bad, or there's no evidence that there's any food that's bad. Then consider the fact that it may not be food, right? It may be an underlying infection. It may be a toxicity that their body can't clear. Maybe some genetic defects that we need to overcome. So this is where I think, again, it's all about what works. If it's working, keep doing it. If it doesn't work, find answers. Start by searching online, but use credible information. And the information better speak to the root cause, right? Can't be just like, hey, eat this food because it's good for that. Like, really? I mean, eat this food is good for that, but is that what you actually have as a root cause of your problem? So if you don't identify the underlying mechanism, then you may be using the wrong food or wrong supplement or wrong treatment to treat the wrong problem, right? So who is it that said that? Dr. Stephen Covey, the author of the 7 Habits of Successful People, says, if you lean the ladder against the wrong wall, then you're going to just get to the wrong place really fast. So make sure your ladder is leaning against the right wall. And I think that's called diagnosis. That's being aware of what the real problem is. And I think a lot of people just go for the headlines and, they kind of do what sounds good, but it's not necessarily right for them.
I'm curious, Doc, since you mentioned, you did mention paleo a few moments ago, I'm going to get a little personal with you, if you don't mind. And if you're uncomfortable, you can set a loving boundary with me. But what is your nutrition that you choose to fuel yourself with and your family members? What does that look like for you?
For my kids, as I mentioned earlier, I have two children that have major sensitivity issues. And so we have done extensive testing with them when they were younger, trying to solve their problem. And we have identified that as a family, we all had at the time gluten, dairy, soy, egg sensitivities, peanut. I mean, we were sensitive to a lot of things. So we basically have to go to a very strict paleo and minus some other foods. So we have to do that when our kids with just 1, 4, and 6. That was the age of them, and we have to make them basically eat a very strict, clean diet. And I will tell you, it wasn't very easy. It was very difficult for little children to try to eat that way, right? And it was even difficult for me because ethnically I'm Chinese. Rice is a staple. Carb is huge. And so I had to change. So we did that for probably at least 4 to 5 years of strict diet like that. And what we did is we retested them after that period of time. And a lot of their sensitivities have improved. So then we start to test, okay, can we try back dairy? And how do they do? Remember, the litmus test is how does it work for you, right? And so we try back dairy. They were okay. It doesn't mean we're giving them dairy all the time. It just means that we don't have to freak out. They're gonna get anaphylaxis every time they touch it, right? And then we tried eggs. Initially, they couldn't even touch eggs. My daughter would have like rash on the mouth from eating eggs, and now she can tolerate eggs. So now a lot of things being added back, and that's actually a sign of a healthy system. You should be able to tolerate a few little junk here and there and not fall apart, right? Now, it's another thing to like not want to eat something that's junky because you just want to stay clean. But if you eat something that's off the menu and you just feel terrible and fall apart, that's a problem. That means your system is not really working all that well. So it's a sign of health and resiliency, right? What we want is adaptability and resiliency. And it's a sign that a patient is getting better when they can actually tolerate more food. Now, to get there, we may have to cut out food in the beginning and heal the system, doing our neurometabolic integration approach by healing the brain, immune, and gut, doing testing and find out where they're deficient in, what they're toxic with. But once we heal the system, what we do is we get our clients to actually eat more food. In fact, the more, the better. More variety of food is what I mean.
Wow, that's such a hopeful statement you just shared, because I think the majority of us believe that once we understand we have an intolerance or an allergy to a food product, we believe that it's for the rest of our lives, because and I think part of that is a huge part is because we haven't figured out how to heal the part of our body that's let's say compromised in that moment. But what you're saying brings a lot of hope to people, including myself, that it shows that with your own family, you are able to now reintroduce certain food products that you couldn't eat before. Your system was not able to tolerate. There's a lot of hope in that. So thank you for sharing that. That's amazing.
Yeah, absolutely. And in fact, I think that's actually should be the norm. But I think in the past, several years, with paleo and autoimmune paleo and various diets being out there, people start to kind of, make diet like their religion, like, oh, I got to stick to this or I'm breaking the law or something. That's not how that works. You should, again, it's about what works for you. Now, certainly I'm not saying somebody with celiac disease, oh, now I cut out celiac for 6 months, I feel better, let me go back and try gluten again. Don't do that, because there's certain conditions where it is a lifelong problem. Earlier you asked, hey, what do you say about curing autoimmune? Because when Western medicine, they say you can't cure it. Well, one thing about autoimmune is that at this point, we can't really say cure. Okay, but what we can say is that we're putting it into remission. And you can put your autoimmune into remission so much so that brain fog is gone, energy comes back, metabolism's better, you lose weight, your digestion's better, skin clears up. All that can happen, and you can lead a normal life with autoimmune by putting it into remission. So in the case of celiac, if somebody has celiac disease and they eat gluten and they just double over in gut pain, they get brain fog, the joints inflamed, and they cut out gluten for 6 months and all that symptom goes away. Did they get cured? Not necessarily, because if they eat gluten again, all that symptom will come back. So what they did is they didn't cure it, they just reversed their symptom by putting it into remission. That's what you do with autoimmune disease. You don't cure it, you've identified all the triggers, which may be more than food, like I said, could be toxicity, infections, and those are things that you can't really look at somebody's eye and say, oh yeah, that's what you got metals, like, we got a test, right? So, but once you fix those issues, it doesn't mean you can't get the problem back, because autoimmune, once you express the genetic propensity for autoimmune, you turn on the genetic expression of that, you'll always have autoimmune. So it's a matter of lifelong management. And that's what we do with our program. We teach our patients, our clients, how to manage it for the rest of your life. So not only do they get better, but they also know how to take care of themselves. I think that's really important.
You just touched on, I just heard you say patients, and then you flip to clients. Why have you made a conscious decision to refer to your clients as clients and not patients?
Yeah, great question, and we kind of talked about it a little bit earlier. The reason I do that because when we say patient, I think people automatically think like, patient means like somebody who might be sick, and then the patient is expecting a drug or treatment, and it's almost like, and I'm not saying everybody think this way, but there's this some people might think that, oh, if I just get a drug or treatment, then that absolves my responsibility for my own health, and I don't have to do anything. Just give me a drug, and I don't have to change my diet or lifestyle or whatever's causing the problem. So I want to get away from that. So it's kind of like a semantics, but it's an important one because that's what we do with our clients. Because when it's a client relationship, then we are basically coaching you how to do it, right? Because at the end of the day, I can't eat healthy for you. Okay? I can't exercise for you. I can't meditate for you. I can't take your supplement. Even if it's a drug, I can't even take the drug for you and you get better, right? You got to take the medicine. So it's more of a partnership where we coach our clients how to do these things, and then they actually got to implement it. So there's that teamwork, that commitment on the part of the client to follow through. So we don't take every client, because some people just don't want to do that. And that's okay. It doesn't make them a bad person. It just means that they're not ready. And then when they're ready, then, we work with them, and people get good results when they follow through, so that distinction, I think, is important in establishing how I work with our clients, what that relationship look like, and also what commitment they need to bring forth to the table to make things happen for them.
That's beautiful. Thank you for sharing that. When a client reaches out to you and they're living in the symptoms, they've been prescribed meds, and they're seeking answers because they're sick and tired of feeling sick and tired, and their disease or condition is progressing. What are some of the first tests that you do?
Well, the test is depending on what's going on with them. So you'll have some functional medicine practitioners or people who say they practice functional medicine that will do the same test on everybody. Then they might be the hormone guy, the hormone doc. So everybody comes in the office, everybody gets the same hormone test. Or then maybe the Lyme doctor. So everybody comes in, get tested for Lyme, the same test, everybody gets the same thing. And I don't believe that should be the case, because if somebody has a broken leg, you do an x-ray. If somebody has a fever, you may not do an x-ray. You might do something different, right? So the test depends on the presentation of the client, what's going on with that person. So then the test is customized. So I don't have a test that I do on every single person, other than, I do blood tests, but the blood tests maybe have different parameters in it, right? I'm maybe looking for a thyroid issue or Hashimoto. I may be looking for vitamin D deficiency. So basically it's what the person brings to the table, what their symptom is. So then we customize that test. So for example, if they have a GI complaint or they have chronic inflammation that I suspect is related to some kind of gut issue, even though they have GI symptoms, they may still have a GI problem, right? So people say, oh, my tummy doesn't hurt, so I don't have GI problem. That's a mistake. You can have GI problems like malabsorption, gut dysbiosis, without having GI complaint. And all the symptoms you have, maybe just fatigue, inflammation, maybe even joint pain. And that could be coming from the gut. So that's looking at the root cause. And that's me asking appropriate questions during the initial case review to identify the symptoms. And in my clinical workup, right, in my head, that's where experience comes in. Working with 5,000 people, it tells me most likely this is here. We need to do the test to rule or confirm that is there. So the test depends on the individual person. Now, if you want to ask me what type of test is available, I mean, there's so many tests available out there, but I will also say that not every test is useful. There's better tests, there's poorer tests. So food sensitivity tests, for example, many different scale of accuracy and reliability. And that may or may not be the first test that we do, because for a lot of people with autoimmune, they have leaky gut. And when you have leaky gut, you have a very sensitive immune system. And what that means is you're going to be sensitive to more food than otherwise. So doing the food sensitivity right off the bat may yield false negative or false positive results. So we may not start there, right? So it depends on the individual person where they are. But we can test for things like leaky gut. We can test for heavy metals. We can test for environmental toxicities. We can test for viruses. We can test for gut infection, absorption marker, deficiencies, things that regular doctors don't test for. So I think people get enamored with the test, but a test is just a tool, right? What tool you whip out depends on the job at hand. So don't get enamored with the test, get enamored with the philosophy, the approach, the thinking process, and then the test will come and the protocol will come.
One of the biggest challenges that I hear people say, and I know you encounter this too, is that, Well, do you take insurance? And we already touched on that very briefly. You're out of the insurance business today. That's not your business model. But so many millions of people are trained in their mind is that I can't afford you. If insurance doesn't cover it, I just can't afford the cost of out of pocket to see you or for your testing. How do you respond and or overcome that objection to becoming a client of yours?
Well, there's multiple ways to respond, and I should say there's multiple ways for that client to pursue some kind of help, right? Even without insurance, even if they have financial situations that doesn't afford them to do that. And that's something that I got to work more to create. And I'm in the process of creating. But so the first question is, how do I respond? How do I respond to that help the clients? It's not about how I respond, it's how I help that person understand what the role of insurance is. Insurance covers drugs and surgery. If you use insurance, it's only going to cover drugs and surgery. And that's fine if it works. Remember, the litmus test is it working for you? If you're already taking medication and the medications don't work, you're still having symptoms, then you have to step outside of that. And that may be something that insurance may not cover. Like, for example, joining a gym may not be covered by insurance. Taking some supplements or buying organic food or talking to Jay Rothman. So those are not covered by insurance, but you do it anyway because you value your health and you feel like that will help you. But remember, with the climate and the environment, the insurance model in the United States now, insurance is getting more and more expensive and cover less and less and less, right? On average, people pay 12 grand a year, average. That's probably cheap for a single person, 12,000 a year for insurance coverage. And what do you get? Nothing. If you have diabetes, you need a chronic treatment, you need drugs. Yeah, that'll cover. What you pay is less than what you will have to pay out of pocket for. But you have diabetes and you're not even getting better. What's the point of that, right? It's about improving your quality of life. So I would say that, $12,000 a year, my program's not $12,000 a year to work with me for 6 months or a year. So in a sense, like, I'm the best deal out there, right? So if you were actually to address the root cause, you might be able to spend less in the future. So that's one way to look at it from the client's perspective. You'll have less out-of-pocket costs. I always tell people you get a 10-to-1 return working with me because I believe you're going to get 10 times back what you put in with me, because in the amount of time saved, the clarity, the improvement, and just knowing what to ask and what not to do. So that's one way. The other way to look at it is this. Maybe somebody just, I really want to, I just don't have the resources to do it. Time, money, it's always the biggest thing. Then that's up to me to create other programs, perhaps self-learning program, right? This is where education comes in. So, perhaps a online digital video modules that can take people through the process so they can self-identify and kind of get proactive with it. It doesn't replace, diagnosis and working with the doctor, running labs, but that can kind of get the ball rolling. In addition to just the free content out there, it can be more protocolized and more assessments that it can be done to help people identify. So that's something I got to create. And then people have a lower tier entry point to get the help that they need, in addition to just a free video. Because free video is kind of like a book, right? You write a book, it's meant to for a certain audience, but it's generic information for most people. It's not customized. But with online now, we can set up questionnaires and assessment tools that can kind of take people through it and make it a little bit more customized. Again, test.
You do that well. You do that well. You have a very active YouTube channel. You put out a lot of free videos, a lot of free educational tools and you do a great job with that. I wanted to also touch on, believe it or not, we're about 10 minutes outside of the hour, and in respecting your time, I know you've got a practice and business to take care of here today. I want to ask you, I want to just touch a little bit on how the business model has changed. You and I chatted pre-show in a studio about that you're based in Arizona. And so if you're on the East Coast, you're thinking, wow, I'd really, really like to maybe be under the care of Dr. Khan, but how can I afford flying to Arizona, Gilbert, Arizona, to be under your care? And the answer is, you don't have to. You can establish a client relationship living in Florida, New York, or Canada, or many other countries outside of the US. Why is that? Because Dr. Khan has changed his business model. We can take a few moments to just expand upon that.
Yeah, I have a 100% virtual online consultation practice where I meet clients over Zoom, just like this platform that we're on. So just like how we're talking and having a discussion, I have these online discussions with our clients. We dive into their symptoms, we ask, history questions, and then we can order labs where people are. We have, test kits we can send them, or labs that we're contracted with that can do tests locally. And so doesn't matter where you are. Now, some countries more difficult, some states more regulations where we can't order certain tests, like New York, for example. But for the most part, we can do a lot. So and I think the benefit is multiple fold. When we do this virtual, and the reason I want to do this because I get so many people reach out to me. It's like, Dr. Khan, I want to get help, but you're in Arizona. And this is when I start putting out YouTube content. People started reaching out to me. So how can I help these people? So virtual is the way to go. Now, the benefit to the client is that you don't have to travel. I mean, even if you see a doctor in town, you're maybe fighting. If you live in Seattle or New York, man, that traffic is just crazy, or LA. So you don't have to fight traffic for 45 minutes to an hour just to drive 5 miles to see a doctor. And then you don't have to wait in the office, because a lot of times you go see these doctors, you're waiting an hour before you see them for like 10 minutes. It's just stupid. That's inexcusable in my mind. I mean, even when I had a brick and mortar in-office practice, people didn't wait more than 15 minutes. But now with the Zoom, I show up at the appointed time, right on time. And Jay, tell people whether I'm on time or not.
Well, yeah, I was about to say, and you actually, I was pleasantly surprised. You were right on time, and I acknowledged that to you. I said, many guests that come into the studio show up a bit late, but you, thankfully, I was on time this morning, as was you, and that impressed me very much. So yeah,
it's a pet peeve of mine to be late. So I show up on time. So what that means, if you have an appointment with me at 10, I'm there at 10, and you just show up at 10, and I'm there. So you don't have to put your makeup on. If you could put your makeup on and do your hair if you want. I do my hair every day. But you can just show up, and you don't have to. And some people have kids that put them in childcare just to take them to the doctor, or drag kids with them to the doctor. You don't have to do that anymore. Just do it in the comfort of your own home. And I mean, we're not here treating a symptom. I'm not giving you an adjustment or a massage. We're talking about your symptom, and we're identifying things that we can work on. So this works really well.
My understanding, as you share with me, is that this business model is relatively new for you. It's just about a year ago that you made the conscious decision to change your business and close down your brick and mortar. And the nice thing about that for you also is that you can schedule appointments with your clients even when you're not at home. When you're on the road, let's say you're traveling for business or for pleasure, you could still be accessible to your clients. I don't want to say 24/7, but certainly your ability to have the clients to have access to you is actually improved and greater.
I feel there's actually more touch points when I went virtual, because they can reach me through Zoom like this. Doesn't matter where I am. Of course, all by appointment only. But I feel like there's actually more touch points, and I'm more available to the client as far as communication wise than I was when I was in the office.
Well, I appreciate you sharing your experience. It is a new trend. A lot of doctors are giving up their brick and mortar to work with their clients and or patients, depending, in a virtual studio, virtual conference call of such. And so I love the model. It can work. From what I'd like to do is ask you, with what time we do have left, if you could perhaps share some closing thoughts for someone that may be listening that is under the traditional care but is suffering and their quality of life is just been so impacted. I'd invite you to close out the show with some closing thoughts.
Yeah, I think if you have chronic health symptoms and you're not improving from what you're currently doing, then it's time to look someplace else. Look above and beyond what you're currently doing. Even if you think your diet's perfect, and some people I think, take too many supplements. I literally just yesterday have a client that just enrolled in our program, and he's taking 22 supplements. I mean, that's just, and he's no better. And so if whatever you're doing, if you're not better, start to seek answers. And one of the first things that I have people do is watch my videos, because that'll really help you to understand some of the mechanisms for why you're having the symptoms. We also offer a 15-minute free discovery call, and it's at no cost, where you can speak to our assistant, our team, and find out how our program works, ask questions about how we help people, what kind of conditions we can help, and that's available to you as well. And then that way, if you feel like it's a good fit, then we can have a conversation and have a case review and actually dive into your case. So my website is askdrkhan.com, and my YouTube channel is youtube.com/PeterKhanDC. If you just Google Dr. Peter Khan Functional Medicine, bald-headed Chinese guy will show up. Pretty easy to narrow. And then you're just, follow my content. I think that's the best source of information. And if you need help, feel free to reach out, have a 15-minute call, find out if we're the right practice for you, and go from there.
Beautiful. I actually added your website to your photo right there. So I added that just a few minutes ago. Yes, AskDrKhan.com is how you can get hold of Dr. Khan. Again, I'd like to thank you for joining me this morning. It means so much to me when a doctor like yourself takes time out of your busy schedule to show up and provide information, content, awareness, inspiration, and hope to those that may be in significant pain of some sort, battling a chronic condition. And my experience is that it's a choice to stay in it. It's a choice to stay in a battle. There's another choice today. The other choice is to seek medical care from doctors like Dr. Khan that offer an alternative solution to what you have been in the loop of dealing with, which is staying in the business model of pharmaceuticals, surgeries, and insurance. There are very, very few people that are given long-term relief. Dr. Khan provides an alternative business model that, in fact, may improve your life, your quality of your life, and how you feel. And with that, Dr. Khan, thank you so much for joining me live on Real People, Real Health. We'll catch you next time. Thank you so much.